let's talk about subcutaneous medications in hospice palliative clients in home care, because that's the main area that I work. So for subcu medications, we're not going to give an injection for every time we're giving a dose. We're typically going to use something like this. This is a safety intima, butterfly, port, lots of names nurses will use for them. It's the main one in the area that I work. There is one other one we sometimes see. I'll do a video on the two of them at another date, but that's the main one. And we're going to use one port for each medication we give. Typically, I see this in basically every patient at some point in their trajectory, because either they've become less responsive, having difficulty swallowing, or because we're looking to improve their response to the medication. They're not getting great symptom management from the oral medications anymore, so we're making that transition. These will typically last for about a week. Some patients do have to have them changed more often, but usually about a week, and then we don't have to make those pokes over and over again. Main question I usually get is it going to hurt? And it's a very small poke. It's kind of like an insulin injection just under the skin. So typically it's not very painful. We often have people that are fearful that this means they're, really approaching end of life. We've had patients who've had this for months or even longer using the subcu meds. So it's not at a certain point in the trajectory. It can be used for a long period. It can also be used temporarily with a switch back to oral if somebody's having increased pain due to some sort of acute thing that's happening, and then we can switch back to oral once their pain is better managed. So a little bit of information on subcu meds before I get into a little bit more teaching about them specifically.